Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. In this video, I would like to talk about medications, common prescription medications, which are associated with an increased risk of blood clots. Now, obviously, blood clots are a phenomenon which no one wants to get. They can range from very mild to very serious or even fatal. And there are different types of blood clots. Blood clots can occur in the veins, they can occur in the arteries, and they can occur in different parts of the body. They can occur distally in the legs, what we commonly call a DVT or deep vein thrombosis, or they can spread up to the lungs, what we call a pulmonary embolus or pulmonary emboli, if there are lots of them. So let me share with you here some common prescription medication classes which are associated with an increased risk of blood clots. Now, obviously, if you're on any of these medications, it doesn't mean that you'll definitely get a blood clot, but there is evidence of an increased risk of blood clots. And it obviously depends on many other factors as well. So please speak to your doctor, but let me share these with you here. Number one, oral contraceptives, birth control pills, particularly those containing estrogen, are associated with an increased risk of both DVTs and pulmonary embolus. Number two, hormone replacement therapy. Along the same lines, particularly those containing estrogen, are associated with a higher incidence of blood clots. These are drugs which are prescribed to help control menopausal symptoms. Number three, antidepressants. Interestingly, studies have shown that many different classes of antidepressants, including common ones such as SSRIs, selective serotonin reuptake inhibitors, tricyclic antidepressants, are associated with an increased risk of blood clots. And there's some debate over why this occurs. Could it be a direct effect on platelets, a component of the blood? This is up for debate, but studies have shown an increased rate. There is also debate over whether it's the actual antidepressant or the effect of the antidepressant, including weight gain and immobility. But that's what studies have shown, an increased risk potentially of blood clots. Number four, antipsychotic medications. Now, we live in a time and a culture where prescriptions for mental health issues are absolutely going through the roof. And there's certain antipsychotic medications. One that springs to mind is clozapine, which has been shown to increase the risk of blood clots. So that's certainly something to keep in mind if you or your family member is on one of these medications. Number five, any medication which increases the risk of immobility. Now, this covers a broad range of medications, any sedative, any benzodiazepine, any muscle relaxant, but it's simple common sense that any medication which will increase immobility will decrease blood flow to the legs and increase the risk of blood clots forming. And that has been shown in research studies as well. Number six, chemotherapy medications. Now, there are a few medications. Two that spring to mind are tamoxifen and thalidomide, which have been shown to increase the risk of blood clotting. So that's certainly a discussion to be held with an oncologist if there is an additional concern. So there you go then, 6 medication classes to be careful of if there is a concern for an increased predisposition to blood clotting. Now again, if you're on any of these medications, it doesn't mean you should stop them, but definitely have a discussion with your doctor because so many individual factors come into the decision about whether to proceed with a medication, benefits versus risks, etc. Do you have other risk factors? Are you immobile? Are you obese? Obesity is a massive risk factor, no pun intended, for blood clotting. Do you have a personal or family history of blood clots, a genetic predisposition? And of course, know the symptoms of blood clots. Symptoms to be aware of include edema, swelling in the leg, especially what we call asymmetric edema. If one leg is more swollen than the other, then that's often a warning sign that something is very wrong, and you may need to be checked out with an ultrasound scan for a DVT. Symptoms of a pulmonary embolus when a blood clot spreads to the lungs include shortness of breath, chest pain, palpitations, dizziness. But you know your own body, and if something is wrong that needs to be checked out, then hopefully you know to get it checked out as soon as possible, particularly if there are other health concerns. Thanks everyone for listening. Let me know your thoughts down below. Check out my online academy. That link is down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.